Assalamu alaikum. Good evening, everyone. It's Donnie, and today I'm talking about benign bone tumors. So we have here four main examples: osteoid osteoma, osteoblastoma, osteoma, and osteoclastoma. So first, let's start with osteoid osteoma. Osteoid osteoma starts with double O. This would remind us that the patient usually complains of severe pain. This pain is usually, sorry, this pain usually increases at night and relieved by aspirin. So the double O's is to remind us that the patient is always complaining of pain with this special feature. And you will find in sentence commonly in case questions to remind you or to give you a hint that this case is talking about osteoid osteoma. This pain is very annoying, and the patient will usually take the advice of three doctors. This is to remind us that we have three main features starting with letter D. Number one, it commonly affects the diaphysis of the femur or tibia, and in bone scan there is characteristic double dynasty sign. So here we have summarized the main information about osteoid osteoma as brief as possible. Again, the pain feature is very characteristic in males younger than 30 years old, increased at night and relieved by aspirin only. And it commonly affects the diaphysis of femur, tibia, and double dynasty sign on bone scan. However, in CT there will be osteolytic nidus, and this nidus is radiolucent, and it's very important to note that it's usually smaller than 2 centimeters. This is very important because we will use this information to differentiate between osteoid osteoma and osteoblastoma on CT lesions. As you can see here, in osteoblastoma, there is well demarcated osteolytic lesion, yet it's more than 2 centimeters with flecks of calcification. Back to osteoblastoma, it is the only benign bone tumor with the letter B in our presentation. So this letter will remind us that it also affects the P, posterior column of the spine, resulting in another B, which is back muscle spasm. So we have B, P, B. This is very important about osteoblastoma. The bone scan will show intense activity, and here in our CT, as you can see, it's affecting the posterior column of the spine, and the lesion is large enough, it's larger than 2 centimeters. Finally, the osteoma. Osteoma affects the membranous and flat bones, so it commonly affects the skull, and it may also affect the mantle. In CT, the lesion is very easy to differentiate it because there is dense, well circumscribed lesions, as you can see here. Boggy swellings on examination, and on CT, dense bony swellings on axial plane. So this is very easy to differentiate on CT, and the axial planes are very important for this diagnosis. Our last and most important benign bone tumor is osteoclastoma. Osteoclastoma is also called giant cell tumor. What happens in this tumor? Number one, the tumor cells express rank L, which later on binds to the rank on osteoclast precursors. This results in rapid increase of the osteoclast number in completely absence of control. The massive increase in the osteoclast number result in severe bone destruction, and that's why this tumor is called osteoclastoma, because there is a very huge number of osteoclast cells. They grow rapidly and divide rapidly out of control, and they do their function more aggressively, so they result in severe bone destruction. It usually occurs in the knees, usually in the metaphysis or the epiphysis, and it may even extend up to the joint. We have two main features, radiological features. First of all, soap bubble appearance, which is common in X-ray, and this is very characteristic for osteoclastoma. And we also have donut sign. Donut sign occurs in nuclear medicine. You can see there's increased uptake in the periphery and decreased uptake in the center. So we have these two classic features to differentiate osteoclastoma from any other tumor. Some researchers have tried some medications to stop the rank L or block the rank precursors or rank receptors on the osteoclast precursors. However, the main line of treatment is still surgical resection, and it's very important to note this information. Thank you so much. This is the end of our benign bone forming tumors brief as possible, and I hope this video has been